What are the best exercises if you have disc pain at L4, L5, L5, S1, disc herniations? Maybe you've even had a surgery and now you want to know, what can I do at home? I still have pain. Maybe I'm getting the sciatica still, the sacroiliitis. What can I do? Here are my top 5 things that you can do at home to help get you relief. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. Here's a model of a low back spine. You'll see the disc, you'll see how thick those are, and it really allows for the nerves to pass out of the spine. And so when this gets changed, or the jelly donut in the middle there, when that starts to leave the disc, well, that's where we're getting a lot of issues. As the spine breaks down, well, you'll see that the disc itself becomes thinner, so it becomes desiccated, meaning that it becomes dry, so it's not bringing in any more water. The bones will start to change around that. That's the natural ability of the body to help solidify the area. So if you've had spinal fusion surgery, then what they've done is they've stopped this area from further damage, which is a good thing. But what happens here to the disc itself is if the disc is slowly bulging, or you're getting the worst would be the actual sequestration, meaning that the inside, the jelly donut, is moving out. So the problem with this is that the nerves that are in your low back, which normally only go around the disc, well, those nerves start to migrate inwards. And the moment that it gets in contact with the jelly donut, you actually will get way more pain because it's an irritant to that nerve. So what we want to do is we want to teach your body how to move properly again, because the question that I would be asking is, why is this happening in the first place? And what happens to the spine is, over time, if the spine has stopped moving, it's out of balance. Well, now you're getting abnormal amounts of pressure put on the disc, and the disc is simply reacting. This is the last stage. This is the last stage. This is where now everything is naturally fused. So whether or not a surgeon fused it for you, or that your body has done it itself. But once it really gets to this stage, well, there's no more irritation on the nerve. And in fact, some people feel a lot better. This is when they start saying, I used to have the back pain. I used to be really bad. I don't feel it anymore. I must be fine. But what's happened here is the disc has completely dried out. The nerve is no longer sending the signal. So you feel good, but you still have a problem. Here are the top 5 things that you can do at home that's going to get you some relief. An easy way to help recreate a lot of the movement that's been lost in the spine is by getting yourself a disc. So this is just, these are workout discs. These are discs that you can sit on. So you would sit on this, and then when you sit on this, the goal here would be to have your feet flat against the ground. You want good posture with this. And then what you're doing is from the hips, so put your hands on your knees. From the hips, you want to dip your hip down. So you want to create, like almost push out your belly. So you're sticking out your chest, pushing out your belly, and then you're doing the complete opposite. Now you're rounding the back. And so you're moving this back and forth in a nice rhythmic fashion. Side to side would be next. And as you start doing this, now we're gonna go side to side. So side to sides. Now as we're doing this, what we're doing is we're promoting movement in the low back. We're promoting movement in the discs. We're drawing more water into the disc. So all these things are going to help plump out your disc a little bit, but just create that movement. And all you're doing is you're going by what you're capable of doing. So if you've had a lot of back pain, a lot of sciatica, you're just slowly moving through this, again, promoting movement. And the last one would be to do circles. So you would go one side, so you're going now all sides, right? You're going front, back, and you're really pushing forward again, and you can really get yourself into it, and then you're going to go into the other way. So I would do about 10 to 15 seconds each side. So all in all, it's only going to take you about a minute to do that one. Again, it's going to promote a lot of the fluid to go back into your disc. It's going to get the disc and the joints moving again, just to create a little bit more ease, less nerve pressure and irritation, which eventually will decrease the amount of inflammation. So you're going to feel a lot better. This next one you're going to do is you're going to lay on your back. So again, you can do this after surgery, after you've recuperated a little bit and you're able to do it. But even if you haven't had surgery, you're going to lay on your back. Your feet are flat against the floor, or in your bed, however you want to do this. And what you're doing is you're going to focus more on your pelvis. So these are pelvic tilts. So all you're going to do is you're going to use your core, so you're going to squeeze in, and as you squeeze in, you're going to pull your pelvis almost like you're lifting up your bum. So you're twisting it this way, holding that for a few seconds, and then bring it the other way. So you're opening up your back, and then you're going to repeat that. So you're going to do this movement 10 times. A nice, easy, slow movement. Breathe through it. Again, the goal here is you're not going to feel like a deep stretch or anything like that. The goal here is to create movement. All right? You're going to repeat that 8 times. And at the end of that, you can rest for a little bit, repeat it again. So I would do 3 sets of this. So 8 to 10 movements with 3 sets of it. And now you're going to go on all fours. And now you're going to get into your cat camel, which is you're extending, you're coming up, you're looking up, you're bringing your bum up, and then you're flipping down, and then you're curling the other way. So it's the same movement, but now up in the air. Now what you want to do specifically with this one is you only want to do 8. So you're tucking in. Use your core to do this. Strengthen your core at the same time. That's going to help stabilize your low back. You're going to keep doing this movement 8 times. This is to settle the disc. And so what you want to do is you want to lay down and you want to use your elbows like this. And all you're going to do, so if you're coming up from this, you want to use your hands to push up and just go as far as you can. Like if you got a lot of spasming and pain at this level, then just bring yourself onto your elbows, and simply all you want to do is look up a little bit. You're creating extension in your low back. And by doing this, you're creating a pressure gradient. And as you create the pressure gradient, water is going to help to start going back into the disc. So again, so you're looking up, and then you can come back down. The goal here would be to be able to do a few of these. So you want to do about 10 of these. You want to hold this for about 5 to 10 seconds. Breathe through it, because again, if you have a lot of pain, you want to breathe through this, right? Use your breath, and then bring yourself back down. This is excellent to decompress your spine. So you're going to put this right in the low back. And so if you don't have this at home, you don't have anything like this, just use pillows. And what you want to do is now you're bringing your bum up in the air and you're splaying this apart because you're opening up the disc. So I would make sure your arms are in front, you're letting your legs drop, and just breathe through this. Just the added pressure of doing this is going to pull your legs down, and it's going to bring your torso up. So you're pulling apart the low back. You can also go to the edge of your bed. This move is going to be far more advanced. So I would not necessarily recommend this next one if you've had surgery or you've recently just had surgery. This is if you've been maybe more in a chronic state, or we're talking before surgery. So you're about to go for surgery, or even that, maybe you're going and getting treatment. This is a great way to decompress your spine. So you would go at the end of your bed. So you're at the end of it, and you're going to bring yourself onto just the edge where your pelvis is. So you're going to bring just the edge, and all you're going to do is level yourself on your bed. Right now I'm on my elbows, and then what I'm going to do is I'm going to slowly let my legs go. And the more I let go of my low back and my legs, the more that my spine is being pulled, and I'm feeling that decompress. This is an excellent way of decompressing your spine. You're just going to hold, breathe through this. So take your breath, breathe in, breathe out, feel through that. Now, if it's excruciating, stop, don't continue. But if you're getting relief from this, and a lot of you will get relief from this, so you're just going to breathe through this. And then after about 15 to 20 seconds, then you can slowly either use your legs to push yourself back up, or you can bring yourself back down onto your knees, which will be a little bit of an easier way to get up. Let your spine reload, feel that pressure, and then you can go ahead and get back up. And for the last one I would do is you want to decompress any pulling that's happening in through your hamstring. So a hamstring can be done quite easily. You can grab a chair, you can bed, a couch, anything that's above, and simply all you want to do is bring your leg up. Now the key here is to make sure that your knee doesn't shoot up. So what you want to do is you want to make sure your knee, so I would start back a little bit, let your knee come down. Some of you, like me, I have tight hamstrings. So just by doing this and bringing my torso a little bit forward, I'm getting a lot of stretch. The moment you have stretch, that's perfect. You're gonna breathe into that. You're gonna hold this for 15 seconds. Sometimes what you wanna do is you can put your hand on your knee to make sure it doesn't. But again, I'm bringing my torso forward. So I'll show you that from the side, right? Like this, I'm bringing my torso forward. And so we're getting that nice deep stretch. You can also turn your foot to one side to get a little bit more of one side of the hamstring, or the other side to get the other side of the hamstring. So there's two hamstrings in your leg, and so that will allow you to get both just by turning your foot from left to right. Those are my top 5 exercises to do if you got L5, L4 disc pain, you're either pre-surgery, post-surgery, you're not sure what to do. Try those at home, see how those goes. Again, the more you promote movement, the more that your body will heal, the more that you'll get less nerve pressure, and more importantly, less inflammation. And that's how that works. You need to move your body. Simply going for a light walk around the block, move your body. The more you do this, better things will go. If you haven't been to a chiropractor, then make sure you're going to a chiropractor. How did this even happen in the first place? Abnormal spinal loading, where the pressures are going through the disc abnormally, or the body is not in the right position. You either got a big misalignment in the pelvis, a big misalignment in the low back. There's a reason why this happened in the first place. And if we're really trying to be preventative, or we're really trying to help you really get through this, if you got a lot of disc pain, but you're not taking care of the source of the problem, then eventually you're just asking for other issues down the road. So please find yourself a chiropractor, get checked properly so we know exactly what's going on. And that way you can come up with a great plan with your medical doctor, your chiropractor as a team in order to get you better. If you have any questions about this video, please leave them down in the comments below. Don't forget to like, subscribe, and share this information. Until next time, we'll talk to you soon.